boa tarde a todos, boa tarde a todos os que nos estão a ver. Hoje temos uma entrevista um bocadinho diferente, vamos conduzir a entrevista totalmente em inglês. Temos connosco Bonnie Clipper, uma enfermeira dedicada totalmente à área da tecnologia, que vem dos Estados Unidos, uma pessoa que nos acompanha há muito tempo. E que temos o prazer de ter como nossa Advisory Board Member, e neste momento como Honorary Committee Member do Lagos Tech Summit. Nesse sentido, vamos ter aqui uma breve conversa em que vamos explorar algumas questões relativas à tecnologia, ao investimento e ao turismo de saúde durante cerca de 30 minutos. Muito bem-vindos. E vamos então continuar com a conversa. Hi, Bonnie. So I was just telling everyone you are a nurse who has been dedicated to healthcare and technology for a very long time, a very good friend of ours. And thank you so much for being here and for always supporting our initiatives.
Thank you, Sophia. Muito obrigada.
It's a pleasure always to have you. So I will go on with our interview, and I would like to start by saying that one of the things that interests me in this conversation with you is to have point of view. You have a mixed point of view. You have a very good view from the States and also from Portugal, because you are always bouncing between the two sides of the Atlantic. So from your vantage point, how is technology fundamentally reshaping the future of healthcare delivery, both in the US and internationally?
That's a great question, Sophia. I think what's fascinating is that almost every country finds itself in a similar position right now. We are all seeing workforce challenges. We're finding shortages of trained and experienced or available clinical staff, whether it's nursing or physicians or therapists. We all are having shortages of these really important team members. The other thing that we're all seeing is that our populations are aging. And as we age, that means that we are consuming more healthcare. And we're seeing that around the world. So we're all experiencing some very, very similar issues. And when we don't have enough humans or people to provide the care that our populations and our communities are going to need, we have to figure out how to innovate. And what does that mean? There is some really amazing technology out there that can help us and act as force multipliers so that we can stretch the trained and available staff and personnel that we have to go farther. We'll never replace them, not at least at this point in time, based on what we have available. However, we are trying to find ways to really extend the availability, the access, and the utilization of the medical and clinical staff that we have right now. So I think technology is going to play a big part in this, and it's going to help us figure out how to leverage technology to provide care. So we really call this care transformation, and trying to figure out how can we marry together technology with our caregivers or our care providers.
Thank you so much. Um, as far as investment trends and the evolution of health markets go, how do you see investment trends shaping the healthcare and digital health markets today, especially when comparing the US to European ecosystems?
Yeah, that's another really good question. I think, almost having AI available in whatever the platform or technology is sort of a non-starter, right? Everybody wants to use this really advanced higher order pattern processing, predictive tool, learning through language models, whatever it might be. I think everybody's interested in what can artificial or augmented intelligence do to help us. For me, when I work with hospitals on this, and even my conversations with my colleagues in Portugal, or in Spain are really around what's the problem you're trying to solve. So in some cases, it might be access. Are there ways that we can look at non-clinical tools to help us with access? So for example, when we have tools that help us with scheduling of patients or scheduling of operating rooms or operating theaters, procedural areas, sometimes people are well intended but can't always see the complete lay of the land, everything that's going on to make the best decision. Yet we know that AI can be faster and often smarter and often more accurate as we train it that way to make better decisions. So, are we optimizing all of our available time slots for scheduling patients or scheduling procedures? We could also say the same is true of staff. And this is again a non-clinical use of AI. Do we have tools in place to make sure that we are leveraging our existing personnel in the most cost effective and smartest way possible? So that's something for us to look at. Then we can shift into clinical applications of AI. And we're seeing in the nursing world that there are tremendous opportunities to give us better eyes and ears to help decide, is there a patient that looks like they're becoming septic and we just don't realize it yet? Is there a patient that looks like they're having an exacerbation of CHF and we just don't realize that? And again, because AI is smarter, it can detect some of these minor changes in labs and in vital signs. And it can also employ some of the predictive analytics to say this patient has a 50 or 60 or 70% chance of becoming septic. What that would do is alert the care provider or the caregiver, whether it's the physician or the nurse, and that would say, hey, something's going on with this patient and we need to pay attention to what we're seeing, or maybe we would need to put an intervention into place sooner that would allow this patient to have a better outcome. So there's a lot of AI that's out there, but we have to start with what's the problem we're trying to solve. I think it is a good climate for investors because there are many tools that are out there and available today. And also, there's a lot of stuff that can be improved upon or that might not even exist. So I think it's a very favorable climate for those who have innovative ideas and investors that are looking to get into that space.
What advice would you give to founders that are looking to build investment worthy health technologies in today's market?
That's a great question, and people ask me that a lot. So, from my perspective, having spent about 35 years in nursing, and also I have been a chief nursing officer running clinical aspects of hospitals for over 20 years. So, I always say the problem you're solving has to be very clearly defined. You cannot be something to everyone. So, it has to be very clearly defined. And if you are working on a clinical product that you believe will solve a clinical problem, it is incredibly important that you involve clinicians as early as you can in the process to give you input and help you test what you are building. Because what happens so often is that technology people have great ideas and they build something and then put it in front of clinicians and it doesn't work, or it's too cumbersome, or it doesn't solve the problem that we have. It solves something that's unrelated, that's not helpful. So it's really important to bring clinical people in as early as possible, get their input, get their insights. And then as your product matures, as your company matures, make sure that you have an advisory board and have clinicians on it. If you plan on having physicians use your product, you need to include physicians. If you plan on having nurses use your product, you have to have nurses. The same would be true of therapists. The same would be true of respiratory therapists. You have to have the people that are going to be the end users of your product. Otherwise, you are likely to struggle with the impact. You also might struggle with messaging. So, how are you communicating this to different disciplines? And how will it work for those that actually procure or purchase your product?
It's really curious because that is the advice I always give to every technology startup that comes to us. I always say that, and nurses are known to think alike. I was a nurse for a very long time, and it is absolutely incredible how really good tools are often wasted because they haven't been healthcare professionals haven't been included in the process, because when they come to market, they don't speak the language. They are not familiar with what professionals are doing in the field, and it often gets completely lost. And a great idea is lost in a very small uh, glitch of in the process. So thank you so much. Moving on to the main area of interest of this of our Lagos Well Tech Summit, our health tourism and wellness innovation. It is an expanding market, and it is growing in all across the globe. Blending healthcare, prevention, well-being is a complex universe. From your standpoint, what role does technology and innovation play in shaping the future of this market?
Oh boy, that's a great question, and I think it's twofold. So for me, and thank you for your comments, Sophia, because once we're nurses, we can never get out of nurse brain. And
It never
for
leaves
me,
us.
never leaves you, right? It's always part of who we are. And even though I'm in technology and I work with hospitals on virtual care and technology adoption, this is a great question because we first have to change the paradigm of prevention. And so often, patients or community members or the public does not see prevention as their responsibility, right? So you might recommend that I lose weight, or you might recommend that I eat healthier, or you might recommend that I eat more vegetables, or maybe that I drink less wine. But I'm going to kind of try my best. And if not, there's a healthcare system that's going to support me. So we first have to educate the public and lay people on the importance of them owning their health and managing themselves as best they can. And at the same time, I believe we can do both of these things. I think we can also offer them tools and technology to manage their own health better and to get to the point of well-being. So I think there's a tremendous opportunity from a technology perspective for us to do that. It's also going to be very interesting to see how we can manage outcomes or improve outcomes by technology, because there is that component that individuals have to own their healthcare. So I could have the best app in the world, but if I really don't think that I need to lose weight, or I'm really not worried about my A1C coming down, then it might not be something that's on the top of mind and I might not use it regularly. We have seen in studies in the past, there was some work that was done in the US a couple of years ago, and we learned that when there seemed to be some kind of a reward, maybe a small monetary reward or discounts off health related services or health related products, that those kind of incentives got people more engaged in their health. So I think we can have the best technology, and there are always going to be some people that are at the head of the curve and want to adopt those things. But oftentimes, people are really in that middle bell curve portion, and they really want a compelling reason that they should care more about their own health and that they should use these platforms or these technologies. And I think that's the area we're going to have to focus on. How do we make it as easy as possible? How do we also help them see those outcomes so they know there's a benefit to using the tool or improving their own health and well-being or getting much more involved in their own prevention?
Yeah, definitely. One of the things that often is discussed is how can tourist destinations use data and personalization and patient experience tool to attract more clients. Portugal is now striving to build its own strategy in health tourism, and these are the kinds of questions that are arising. What would be your view on this?
I think there's a couple of pieces that we have to have in place. We want to make sure that we have world-class healthcare. We want to make sure that we deliver from a tourist perspective, making it as easy as possible to get there for the services. We also want to make sure that we have kind of wraparound support. So that means maybe educating and preparing people before they come for a procedure or a treatment, and then also supporting them when that treatment or procedure is done. Oftentimes, there's a short term where they would stay in the community that they just had this procedure or treatment, get some check-in visits with a nurse or maybe with a physician. And then at some point when they are discharged, they would probably go back to where they live, to their home. So I think all of those steps are very important. We can collect data along the way. Where are people coming from? What are they coming for? Who are they seeing? What facilities are they going to? How long are those stays? And then we can also start to look at the actual clinical procedures themselves. Are there best practices being followed? Are there standardized workflows being followed around procedures that make them not only efficient and cost effective? We also know in healthcare that we have to generate the revenue to continue to provide care. So how do we make sure that all of these pieces are happening? And every single one of these is an opportunity for data. We also want to collect data down the road, both short term and maybe longer term, to see how those patients did with a particular treatment. Because eventually, everybody wants reviews and wants patient experience or Google reviews. So we have to be able to say, if I came to Portugal for a certain treatment, I can put my review out there and everyone in the world is going to see that this was an amazing opportunity for me to get world-class care. And a year later, I'm still having great outcomes.
Sure. Great point of view. Thank you so much. So, Bonnie, we'll wrap up. And thank you so much for taking the time for this interview again. What message would you leave to anyone who would like to be in Lagos next year? What to expect? Why would these people need to be there?
Because I think this is an opportunity to be on the cutting edge. We're bringing together innovators, industry partners, and investors. This is a great chance to start solving some real problems and also improving care and outcomes for our communities or for individuals around the world. Portugal can be a leader in many things. So I'm a resident. I love spending time there. And I think that there are some really amazing things going on in Portugal. This is our chance to really start to tell this story on a bigger stage.
Bonnie, thank you so much. And we'll see you in Lagos next year. Thank you.
Absolutely. Muito obrigada.
What if you could be part of a revolution that transforms healthcare as we know it? Welcome to Digital Health Portugal, where innovation meets collaboration. Our mission is to foster the transformation of healthcare systems by promoting open dialogue, civic engagement, and the adoption of innovative technologies. Imagine a world where patient outcomes are optimized and healthcare delivery is seamless. Our Digital Health Manifesto is the strategic framework guiding this transformation. Our events, seminars, and workshops create momentum for sharing and discussing health-related ideas. Experience the power of collaboration at our quarterly meetups. Portugal's thriving startup ecosystem is reshaping the digital health industry. Our products and services are uniquely created to match your communication goals. We are the most relevant civic engagement platform for health innovators. We partner with Forum Hospital do Futuro to foster a sustainable national health service. Our think tank SNS Decantas Certas is committed to driving the transformation of the National Health Service through open dialogue among public, private, and social sector stakeholders. We encourage knowledge generation and support policymakers in understanding health ecosystem needs. Be part of the movement, advocate for change, and co-create the future of healthcare. Our members are united by a shared purpose to drive meaningful innovation and transformation in healthcare for the benefit of all. Dive into our podcast to uncover actionable strategies from our think tank plenaries. Join our LinkedIn Live sessions for engaging discussions with healthcare leaders and innovators. Join us at the Health Data Forum Global Hybrid Summit to shape the future of health data. Our goal is to raise the excellence of the Portuguese healthcare ecosystem internationally. Be part of the digital health revolution with Digital Health Portugal and make your mark.
Everybody is looking for better healthcare solutions. What if AI could be the answer? AI in healthcare isn't just a buzzword, it's revolutionizing patient care. With AI, we can achieve more accurate diagnoses and personalized treatments tailored specifically to each patient. AI systems analyze vast amounts of medical data at lightning speed, identifying patterns that might be missed by human eyes. This means early detection of diseases, fewer errors, and more effective treatments. But the magic doesn't stop there. AI helps streamline administrative tasks, giving healthcare professionals more time to focus on what they do best, caring for patients. The result? Enhanced patient outcomes and improved quality of life. So whether it's predicting patient needs or making real-time decisions, AI is transforming healthcare, one patient at a time. Embrace the future with AI-driven healthcare solutions. Because better health outcomes start with better technology. Ready to take the leap? AI in healthcare, better diagnoses and treatments, making healthcare smarter, one innovation